Hello, everyone, and thank you for joining ACEEE's webinar, Employing Energy Efficiency to Protect Health and Mitigate the Effects of Climate Change. This webinar is part of our Health, Environment, and Energy webinar series. And my name is Cassandra Cubes, and I work on ACEEE's Health and Environment program. And before we get started, we'd like to go through a few logistics. We will be holding a Q&A session at the end of the webinar, but please type your questions in as you think of them into your chat box so we can have a running list to get through at the end. Also, all of the audience is on mute, so again, please type any questions or concerns into your chat box. And the webinar is being recorded, and we will be posting it onto ACEEE's YouTube page, and we'll be sending a link out to view the recording to all webinar registrants. So this is actually the second webinar in our series, and we are hoping to be able to continue exploring the intersections of health, environment, and energy to really get a better understanding of how these sectors are working together while highlighting the latest research from experts in these fields. And I wanted to put this slide up for any of those in the audience who are unfamiliar with ACEEE. We were founded in 1980. We're based in Washington, D.C., and we perform research on efficiency programs, policies, technologies, investments, and behaviors. And we work across the country and internationally as well. So here are the webinar speakers for today. We are going to get things started with Mona Sarfati, who is a medical doctor and the founding director of the Medical Society Consortium on Climate and Health, based within the George Mason University Center for Climate Change Communication. She is a family medicine physician and public health doctor who has engaged in teaching, research, and advocacy for over 30 years. And now I'm going to hand things over to Mona. So Mona, go ahead and get started.
Hi, okay, so thank you for the introduction, and thank you for inviting me to speak this afternoon. As you heard, I represent a coalition of medical societies called the Medical Society Consortium on Climate and Health. And we started with some research about 5 years ago by surveying doctors around the country to see whether they knew that climate change was happening and whether they felt that there was any evidence in their own practices of impact on health. And what we learned was that they did see evidence of impact, and they thought it was affecting their own patients adversely, and they had some very specific observations about how it was impacting their patients. And so from there, we brought together several big societies and decided that we needed to speak out. Next slide. So we put out this report called Medical Alert: Climate Change is Harming Our Health. It's all evidence-based. When we released it, we didn't have quite so many members. We now have 24 medical societies that are members, and they represent 60% of all the physicians in the United States. And we also have 33 affiliated public health groups that work with us, such as the American Lung Association and the American Heart Association and the American Psychological Association and many others. And our mission is to organize, empower, and amplify the voices of America's physicians and other health professionals to inform the public and policymakers about how climate change is harming our health and how climate solutions could improve it. So I want to speak a little bit about how climate change is harming our health. Next slide. So we were very concerned that most Americans didn't really understand that climate change was a personal threat. Most of the imagery in the press focused on polar bears and glaciers and penguins and things that are real concern for nature lovers, but didn't resonate for many, many Americans. And so there were only a minority that understood that climate change was a threat to them or to their communities. This report was intended to fill that gap in awareness. Next slide. So all Americans can be harmed by climate change, but some face greater risks than others. And those who do are children, students, especially who play sports, children or students who play sports outside, pregnant women, elderly individuals, people who have any kind of a chronic condition or allergy, and people with limited resources. Next slide. Some of the health impacts that I'm going to talk about come from several different phenomena. And so heat is a big one. Heavy rain and flooding is another. Droughts and fires are others. And then mosquito and tick-borne diseases are others that you've undoubtedly heard about. There are additional threats, such as nutrition and food security, threats to mental health. I'm not going to talk in great depth about those. And there are lots of physician stories out there. Unfortunately, time is limited, so we really won't have a lot of time to do that, but I think Dr. Bowl will fill in some of that. Next. So extreme heat. As everybody realizes, we have more very hot days, there's more humidity, there are more frequent heat waves, and they last longer. And this can lead to heat illness and even death from heat stroke or dehydration. And some chronic diseases are worsened because of the heat. And while anyone can be harmed, some people face greater risk, and that includes people who work outdoors, as we mentioned before, pregnant women, students who are playing sports, city dwellers as well, since it's often warmer in cities, and so on. And we can supply the slides so that you have this complete list. Next. So I want to tell you a story about Dr. Samantha Ahdoot, who's a pediatrician who works in Northern Virginia. And her 11-year-old son, Isaac, was at band camp when she got a call from an emergency room that he had collapsed while playing the clarinet. They rushed to the ER and they found out that Isaac had experienced heat illness. And that day was part of a record-setting heat wave in DC with the heat index reaching over 120 degrees. But this was Dr. Ahdoot's wake-up call. And ever since, this is about 5 years ago now, 6 years ago, ever since she has been focusing very intensely on making sure that people understand that climate change is a danger to our health. Next slide. So emergency room visits for heat illness increased by 133% between 1997 and 2006. Almost half of those were children or adolescents. And it's important to note that young kids don't regulate their body temperature like adults do. And of course, they spend more time outdoors. Next slide. Next slide. So the heat also is often coupled with the drought, and drought has meant more wildfires and a longer wildfire season. It's also meant decreased food crops in some areas of the country and water shortages. Next slide. I want to tell you the story of Dr. John Meredith, who's an emergency physician who works in Eastern Carolina University in North Carolina. There was a wildfire there in 2008, and he was in his ER when he started to see many more cases of lung conditions and also heart conditions. And he became quite concerned and asked some of his colleagues to join him in studying the impacts of this wildfire by comparing those counties that had received the plume of the fire with those counties that didn't. And they had enough aerial photography that they were able to figure out which counties were getting the plume and which weren't. And if we advance to the next slide, you can see there, just how clear it was that there were some parts of the state that were getting the plume of the smoke from the fire and others that were not. And when they looked at the emergency room data, comparing those two groups of counties, they found that the counties that received the plume had higher rate of visits to emergency rooms for all kinds of respiratory conditions, asthma, chronic lung disease, even pneumonia, bronchitis. And there was also an increase in heart conditions, including heart attacks, and episodes of heart failure. Next slide. Messages that these blazing fires are damaging to human health, like they are to homes and neighborhoods, and often the impact can occur hundreds of miles from where the fire is because the smoke plume carries. Next slide. The smoke from these fires amounts to air pollution because smoke is basically little tiny particles, in large numbers. Heat also increases the amount of smog in the air that just forms because of the fumes, the hydrocarbon fumes, and the light and the heat. We also have more pollen because pollen-producing plants are growing more robustly, and they've spread over larger areas, and they have a longer growing season. So all three of these things together make for air pollution, which can have impact on people's health. Next slide. So what's happening is that climate change reduces the air quality because, as we said, the heat increases the smog, the wildfires, pollen production, and the ozone levels increase whenever there's heat and light and gases in the atmosphere. And this impacts people who have asthma or allergies. It can lead to hospitalizations and deaths. And it can also affect people to cause lung and heart disease, as we saw when we discussed North Carolina. So anyone can be harmed, but any kind of a pre-existing respiratory condition makes somebody extremely vulnerable to this. Next slide. This is a map of the country, and it shows by latitude the number of days that pollen season has increased at each level. And you can see that as you go further north, the lengthening of pollen season is greater. So this is an illustration of to the extent to which the small pollen particles contribute to the problems with the quality of the air. Next slide, please. So another important health effect is the spread of diseases that are caused by ticks and mosquitoes. And I have a colleague who likes to say that the greatest health threat of climate change may actually be the smallest, which is the mosquito. Next slide. So what's happening is that the increased temperatures and the changes in rain can mean that the conditions for growth of these insects become more ripe, and they spread, and they can carry more diseases onto further areas. And especially included amongst those diseases are those that you've heard of, including Zika, dengue fever, chikungunya, the tick-borne diseases or Lyme disease, and then there are some that you may not have heard of, like ehrlichiosis and anaplasmosis. But the message is that these diseases are spreading, and they're spreading because the habitat for the insects is increasing. Next slide. Okay, so next slide. Next slide. I'm getting toward the end of my time here, and I don't want to take up too much time, but I do want to mention the story of internist Nitin Damle. He's a internist who practices in Rhode Island, and he's seen a tremendous increase in Lyme disease in his office. He used to see 2 to 3 cases a month. Now he sees 15 to 20 a month. That's a pretty big increase. Next slide. This map shows the places where Lyme disease has spread since 2001. And in fact, the number of tick-borne diseases have increased 3-fold according to the CDC. So it's major expansion of the geographic area of these diseases. Next slide, please. So extreme weather, of course, we've seen the impact of the hurricanes and the torrential rains. And we know about the flooding and the tremendous destruction of property and homes and the mental health impacts associated with those. Next slide. And this is the story of Dr. Claude Tellis, who's a retired critical care doc down in Louisiana. He was there in 2016 when they had a 1,000-year rain event caused flooding in about 30% of the land area of the state. There were deaths, 30,000 people rescued, 10,000 were in shelters. Next slide. And it took a very long time for them to get back to any sense of normalcy. And the mental health impacts were long lasting on many people, but he heard about the children from the teachers who said that the kids became afraid every time it rained. Next slide. This shows the increase in heavy rains around the country, and you can see that they're rising everywhere, more so in the Northeast. And this is because the hot air holds more moisture, and then that moisture comes down in the form of torrential rain. Next slide. Okay, so our organization is dedicated to letting the public and policymakers know about the health impacts that you've just seen and heard about, and also that the solutions, clean energy and energy efficiency, will help protect against those health impacts. And we have doctors around the country who are speaking out about this. They're giving presentations, they're visiting policymakers, they're writing op-eds, and we've also got state-based affiliates. Next slide. And so one of the pages in our website shows the various states where there's activity going on. This was all that I could get from the screen, the print screen, but there are other states there. And next slide. You can see that there are states across the country where physicians are organizing and trying to make changes at the state level in policies that will help protect us from further damage to the climate. So thank you very much. And I guess we'll go on to the next speaker.
Thanks so much, Mona. It was a great presentation. And let's see. And now I am going to continue on with talking about how energy efficiency fits in. So Mona set things up really nicely to describe the linkages between climate change and health. And now I'm going to talk through some of the ways that energy efficiency can protect health and mitigate the effects of climate change, and in particular for vulnerable populations. So including children, seniors, communities of color, and low-income communities. So here is a brief overview of what I'm planning to run through. We'll spend a lot of time on the multiple benefits of efficiency, and then I want to tee some things up on state energy efficiency policies before we hear from Dr. Aparna Bull. So this is a graphic from the International Energy Agency's 2018 Market Series report, and it shows that energy efficiency could provide more than 40% of the abatement required by 2040 to be in line with the Paris Agreement. You can see the gigatons of CO2 emissions on the left-hand side in the time period below. And energy efficiency, really the top line message here is that when combined with renewable energy and the other measures you see here, CCS stands for carbon capture and storage, energy efficiency ends up being indispensable to achieving our global climate targets. So it's a really key strategy in terms of being able to mitigate the effects of climate change. So now looking to energy efficiency, it really goes beyond just saving energy. There are multiple benefits to those who both install the energy efficiency measures and to society more broadly through improvements to the environment and public health. And energy efficiency, before I get too much further, to kind of set the stage for everyone who may not be as familiar, efficiency is achieved when outdated practices and technologies are replaced with new and less wasteful approaches. And there's really a long history of governments and utilities implementing programs and policies to save energy. And some examples of those technologies and policies can include everything from efficient appliances such as Energy Star, LED lighting, insulation, building energy codes, fuel economy standards. So these are all things that can produce energy savings while still maintaining that same level of productivity from that technology.
No digits. Please re-enter your access code.
And if everyone could just mute their lines for us. Thank you. So
to enable audio control.
We'll just wait a second. If everyone could just mute their lines. Thank you. Let's see. Okay, so moving along, so historically, communities of color and low-income communities have been disproportionately burdened with the health and economic harms that are byproducts of fossil fuel generation. And energy efficiency is really a tool that can help to achieve our environmental justice goals. And it leads to health and environmental benefits while creating economic opportunities, improving the safety and comfort of our buildings, and saving people money, as you can see in the list here. And now I want to turn first to health in the built environment. So in the US, 53% of the building stock is more than 35 years old. And in some cases, these older buildings were constructed with hazardous materials such as lead and asbestos, and also malfunctioning equipment and building systems can be a concern in older buildings, along with poorly sealed building envelopes that can allow in things like pests and moisture and air pollution that could all be triggers for asthma. Also, low-income populations and people of color are living in homes with inadequate housing conditions at disproportionately high rates. According to US Census data, low-income households make up 37% of respondents, but actually represented more than half, 56% of households with inadequate housing conditions. And African American families are 60% more likely to be living in inadequate housing conditions than white families. And many of the chronic diseases are actually exacerbated by inadequate housing conditions, disproportionately falling on low-income populations and people of color. And this can include suffering from higher asthma rates, heart attacks, stroke, and high blood pressure. And looking now further at asthma, 1 in 10 school-age children has asthma. So it's really a problem for children. And in particular, Black children are experiencing asthma at more than twice the rate of white children. And 40% of this asthma is associated with home exposures. So things like moisture and mold growth, swings in temperature, infiltration of pests, those can all be triggers. And energy efficiency, different upgrades can help to make homes safer and healthier by improving housing conditions. You can see from this graphic here doing things like providing more insulation or air sealing, upgrading heating systems, improving ventilation. All of these things can lead to improvements in health. For instance, leaky windows and poor insulation can lead to cold drafts and temperature swings in homes during summer and winter months, which can trigger asthma attacks and exacerbate other illnesses. But after installing energy efficiency measures, this can help. In a senior housing complex that was weatherized, extreme indoor air temperatures were actually reduced, and residents reported improvements in quality of health and hours of sleep, as well as decreases in emotional distress. And while the connection between health and the home environment is well established, there is some variability to consider, including variability in the energy efficiency measures offered from one program to another, the condition of a building, particularly the starting condition before you put on the efficiency measures, and the health and welfare of program participants. So for instance, a household, say with 1 or more occupants suffering from asthma might be much more affected by mold or excess moisture in a home than a family with no respiratory illnesses. So in addition to looking within the home for improving health, energy efficiency can also improve the resiliency of buildings, especially when faced with extreme weather events. Weatherization and building energy codes, for example, can help homes to have better insulation, improved windows, and tighter building envelopes, which can help temperatures actually stay level for longer, even when there's a power outage. And there's a risk of having extreme temperature swings within the home. So you can stay level temperature for longer. And combined heat and power systems can also provide power when the grid is down. And it's been particularly the case for these bigger storms we've experienced several years back. Superstorm Sandy helped many buildings to be able to stay online. And you also see pictured here, this is from Hurricane Harvey, and this is a quote talking about homes that were built to the latest building codes actually performed well in neighborhoods where homes next door were actually completely destroyed. And another point I want to make is that, why energy efficiency compared to, other options such as renewable energy or other forms of generation. And energy efficiency on the whole actually costs less than other resources. On average, it's about 3 cents per kilowatt hour, which is cheaper than any of the resources that you see listed here. And utilities have a choice when choosing to build new power plants to meet their demand. Or they can invest in energy efficiency to reduce that demand. And really, it costs less to save energy than it does to make it. And reducing energy consumption, it also reduces utility bills, which can improve the financial security of families. And this is a graphic that was taken from a report released by ACEEE and Energy Efficiency for All in 2016 called Lifting the High Energy Burden in America's Largest Cities. And we measured the energy burdens in 48 of the largest cities in the US. And energy burden means the percentage of household income that goes toward energy costs. And we looked specifically at utility energy bills. And we found that low-income African-American, Latino, and renters pay up to 3 times more than the average household on home energy costs. And this impact is really felt strongly on seniors of color as well. Nearly 50% of African-American households over the age of 65 are energy burdened, and 40% of Latino households over the age of 65 are energy burdened. And these high energy burdens can have a real implication on the health and well-being of families who have to devote a higher proportion of their income to utility bills and then may have to make trade-offs between heating and cooling their homes and affording other more important necessities such as food or medicine or childcare. So it can have a really big impact on families. And now I want to move to kind of more societal impacts of energy efficiency. It could really protect the environment. So by saving energy in buildings and making vehicles more fuel efficient, we're burning less fossil fuel. And we then reduce the pollutants that they emit, which results in substantial environmental and health benefits. So as you can see here, when we take into account the pollution involved in kind of the whole cycle of energy production, you can see that the environmental benefits of energy efficiency result in fewer pollutants reaching our waterways, less pollution in the air, including toxics like mercury and arsenic and lead, and less harm to wildlife through drilling and mining, in addition to a reduction in CO2 emissions that lead to climate change. And these are health effects of fossil fuel pollutants, which Dr. Sarfati touched on earlier. They all can really have a big impact on improving public health. And they really can contribute to, these pollutants can contribute to some of the leading causes of death in the US. So as you can see here, they impact all the major organs of the body. So things like cancer, chronic lower respiratory diseases, heart disease, and stroke can all be minimized due to energy efficiency. And I do want to point out as well that many of the health harms experienced tend to be closer to the emitting source. So communities that are living closer to these emitting facilities could see more health benefits from energy efficiency. And I wanted to bring up this graphic in order to get a better sense of where energy efficiency can provide sort of the most substantial public health benefits. We partnered with the Physicians for Social Responsibility to release a report last year, and this graphic shows the results from that report called Saving Energy, Saving Lives. And we wanted to see what a 15% reduction in energy consumption nationwide would result in using a couple of different modeling tools. And we found that these are just annual results listed here, but it could result in a reduction of 6 premature deaths every day, prevent tens of thousands of asthma episodes each year, and save Americans up to $20 billion in avoided health harms annually. So these are some pretty significant health benefits from energy efficiency nationwide. And really quickly, we also in the report, we ranked the states and cities by the highest avoided annual health harms in dollar value from energy efficiency. And as you can see here, some of the greatest opportunities are in the Mid-Atlantic, with Pennsylvania coming in first here, also in the Midwest and Southern US. And you can see Missouri rounding out the top 10 here, or rather the top 15, excuse me. And then here, this is the rankings of cities that show New York City would see the greatest benefits, with more than $1 billion in avoided health harms over a 1-year period. And two, I want to point out that these are just results for 1 year. So energy efficiency measures, when installed, they would save energy and reduce pollutants and produce public health benefits, presumably over the lifetime of that energy efficiency measure, which can be, upwards of 10 years, depending on what the measure is. So you can imagine that these benefits would accrue over time. And finally, I just wanted to introduce some state-level energy efficiency policies. And this is taken from ACEEE's 2018 State Energy Efficiency Scorecard. And our coworkers are hard at work on trying to release shortly the 2019 Energy Efficiency Scorecard. But I wanted to put this up because this is kind of a good overview of some key state-level energy efficiency policies that can really produce some big energy savings. And you can see them listed on the right-hand side there, the 6 policy areas that we look at for the scorecard. And I wanted in particular to highlight the utility programs area. That area is allowed the most points in the scorecard. And in a recent report that the ACEEE release called Next Generation Energy Efficiency Resource Standards, we found that energy efficiency resource standards, which are a policy that require utilities to meet certain savings targets, they are delivering really huge gains. In particular, 80% of all electricity savings in the utility sector. So EERS policies, or energy efficiency resource standards, they've been adopted in 27 states over the past 2 decades. They've been proven to be a really effective utility sector energy efficiency policy. And I wanted to tee that up before turning things over to Dr. Aparna Bull, who will then speak more to her experience specifically in Ohio, and talk about how the health and energy sectors are working together to move energy policy at the state level. So that'll wrap things up from me. And now I will turn things over to Aparna. Aparna Bull is a medical director of community integration at Rainbow Babies and Children's Hospital, and an associate professor of pediatrics at Case Western Reserve University School of Medicine in Cleveland, Ohio. She leads efforts to build close partnerships with community organizations and stakeholders to enhance the well-being of patients and families at the hospital, and supports innovation in women's and pediatric primary care delivery. And now, Aparna, I'll hand things over to you.
Thank you. Can you hear me okay?
Yes, we can hear you well.
Okay, thank you. So, I wanted to spend some time at the conclusion of our presentation sharing how we're approaching health-based energy efficiency and climate advocacy in Ohio. A lot of times I find that both that a lot of external stakeholders and also some clinicians wonder why a pediatrician would be so involved with advocacy related to energy efficiency and climate change. And Mona laid out nicely why an increasing number of clinicians are concerned about climate change as a health issue. And we in our state are organizing clinicians in a group called Ohio Clinicians for Climate Action to kind of amplify our voices at the state level around health impacts of policies that affect climate change and air quality in our state. And we've had some ongoing policy debates and battles going on in our state related to energy efficiency. And we've had some wins and losses, but I'm going to conclude by describing kind of how that's gone and where we stand. But first, next slide, please. I want to just spend a minute not reiterating the health impacts of climate change that Mona laid out so well, but to explain why I describe climate change as fundamentally a child health issue. And we know that that messaging is really helpful to kind of cut across the politics of energy efficiency and climate change, and to help our community understand energy efficiency and climate change in a different kind of way. So the American Academy of Pediatrics has a strong policy statement calling us to action around climate change as a children's health issue. We know that children are disproportionately affected by the health impacts of climate change for a number of reasons. Mona mentioned one of them related to heat stress, but also children experience critical windows of growth and development that render them especially vulnerable to environmental exposures. They breathe more air per pound of body weight than adults do, so their dose exposure to air pollution is higher. And they rely on adults and community infrastructure for their basic needs, so catastrophic weather events are especially traumatic for children. And our policy statement has a pretty strong call to action describing a failure to act on climate change as an act of injustice to all children. Next slide. As Mona pointed out, there you know what, I'm going to let you just advance through the bullet points, please, on here. I didn't realize it was animated, my apologies. But Mona described the fact that too often climate change has been sort of regarded in the popular imagination as something that affects another species in another place at another time. And so in Ohio, we talk about how climate change is already affecting our kids. If you remember the slide that Cassandra just showed about the top cities, avoided health harms of energy efficiency measures, 3 of those cities are in Ohio: Cleveland, Cincinnati, and Columbus. And the bolded bullet points at the top are the points that I focus on in our state. These are the ways in which I'm already seeing in my patients every day climate change affecting the health of our kids. And that is with worsening air quality, extreme heat, increasing frequency of extreme precipitation events, and changing patterns of infectious disease. We know that these extreme heat waves that we're experiencing can overwhelm our health systems. In the 90s, when there was over a week-long heat wave of more than 90 degrees in Chicago, we know that first responders and emergency departments were overwhelmed by the needs of the community as people became sick. And we know that Cleveland could face heat waves of that magnitude annually by the end of the century. And I have been seeing this summer kids coming to me in my practice, or my patients going to the emergency department with heat exhaustion from their summer camps and their sports practices. Heavy rain events. We already know that the heavy rain events of greater than 2 inches in one day are already twice as frequent in the Midwest as they were a century ago. We're actually in the middle of one right now. We know that the runoff from those rain events affects Lake Erie's water quality. It affects our water quality, our drinking water quality. It also affects our lakes with harmful algal blooms in Northwest Ohio every single year, and those are getting worse. And then we also see property damage and displacement. And then Mona mentioned some of the changing patterns of vector-borne diseases. I want to spend some time in the next few slides just sort of talking about air quality a little bit more, because I think it's a really important point to highlight when talking about energy efficiency as a health issue. I'll have you go to the next slide. So the World Health Organization for a long time has had air pollution and climate change as at the top of their list of global health threats. They publish an annual top 10 list. I like to remind my pediatrician colleagues that vaccine hesitancy has made that top 10 list for the first time, and to a great deal of coverage by the pediatric health community. Well, air quality and climate change has been there for years at the top of the list. Next slide, please. And we know that that more than 90% of the world's children breathe toxic air every day. This is a very pressing issue, and these are the kinds of things I want people to picture when they think about energy efficiency and climate change, that it's not some sort of abstract and wonky issue, but something that impacts the health of our kids every day. Next slide, please. You've heard a lot about asthma, and it's true, asthma is one of the more relatable ways in which air quality affects our health. Cassandra mentioned that African-American kids have twice the prevalence of childhood asthma as the general population, and partly as a reflection of that, Cleveland, in my city, more than 1 in 5 children suffers from asthma. And we know that the Asthma and Allergy Foundation published a report from 2018 identifying 20, quote, most challenging cities for those with asthma, and 6 of those cities are in Ohio. There is no other state that comes close. Next slide, please. But I think it's important for us to understand, especially as pediatric health advocates, that there are other child health outcomes that are impacted by air quality. And one of those is infant mortality. As many of you might know, across the country, disparities in infant mortality and critical levels of infant mortality are an urgent public health issue. And that means infant mortality refers to a baby that dies before his or her first birthday. This is a health crisis in Ohio and in Cleveland, is a major focus for our policymakers and our public health experts. And we know that air quality, specifically particulate air quality and other pollutants from burning fossil fuels, especially coal, are contributors to low birth weight and prematurity, both of which are important determinants of infant mortality. There have been studies that have demonstrated that in communities proximate to coal and oil power plants, when those plants are closed, there is a drop in preterm birth and low birth weight. One study out of California showed a 20% drop in preterm birth after closure of coal-fired power plants in communities proximate. And to quote one of my obstetrician colleagues, he said, if we invented a technology that could decrease premature birth by 20%, we would be shouting it from the rooftops. And that technology exists, and it relates to energy efficiency. So I think that's an important point, and it's something that's very relevant in Ohio. The next slide, please. We also need to understand that air pollution has impacts on the developing brain, even prenatal exposure to air pollution. Again, the same kinds of air pollutants I just mentioned, especially the kinds of air pollutants emitted from coal-fired power plants. That exposure can cause disruptions in learning, cognition, behavior, attention, and even sleep. And this headline is very striking, that air pollution might be the new lead. So in a state like Ohio, where our governor has highlighted child health as an important policy priority, two of the biggest child health issues that we're focusing on relate to infant mortality reduction, as well as increasing school readiness, making sure our kids are ready to go to kindergarten and learn and succeed in school. And we know that air pollution and therefore energy efficiency are related to both of those child health outcomes. And connecting those dots is an important role that we play as clinicians in our state. Next slide, please. So I like to remind both my clinician colleagues and our policymakers that energy efficiency is especially a child health issue in Ohio, and that's how I like to describe it. I'll spend some time in just a second talking about our current sort of policy battle in our state related to energy efficiency and renewable energy. Had an opportunity recently to go to testify before the Energy Committee in the Ohio Senate in opposition to this bill called House Bill 6, which I'll describe in a moment. And it was very interesting because I don't think that group is used to hearing from clinician voices, and it really was received in a different kind of way to be able to come in and say, I'm speaking for the Ohio chapter of the American Academy of Pediatrics, and Ohio's pediatricians are concerned about steps backward when it comes to energy efficiency and renewable energy. We regard clean energy and energy efficiency as important child health and public health issues. And I think it was a very important and effective kind of messaging to reach those policymakers. Next slide, please. As Mona mentioned in describing the work of the Medical Society Consortium, we know that clinicians, and especially primary care physicians, are a really trusted voice when it comes to climate change messaging to all different kinds of audiences, whether those audiences are sort of politically inclined to be concerned about climate change or not. So we know that our voices are incredibly important, and that's kind of what we've seen play out here in our state. Next slide, please. So just to tell you a little bit about House Bill 6 and what we've been doing in this space, Ohio's House Bill 6 provides a taxpayer-funded and consumer-funded bailout of 2 nuclear plants in our state. It also extends subsidies for coal-fired power plants, including one plant that is in Indiana. And it also repeals our already fairly unambitious energy efficiency resource standards and renewable energy portfolio standards. It also creates barriers to development of new wind energy. It does have this thing called a clean energy fund that contains the nuclear bailout, but it will also subsidize a few select solar projects, but otherwise renewable energy is specifically excluded from that fund. And by way of context, there have been attempts to repeal our energy efficiency and renewable energy standards over the past several years. It comes as a battle we fought many times. I'm proud to say that our clinician group has been really strong in advocating to keep those renewable energy and energy efficiency standards and to strengthen them, especially as child health measures. This is one screenshot of an op-ed that I and one of my pediatric pulmonology colleagues wrote about the current version of this bill, but we've done it every couple of years. We've had clinicians writing op-eds, participating in policy advocacy. I would say this time around, our advocacy was it has been perhaps the strongest it's ever been, in that we had clinicians from all corners of the state writing op-eds in their local papers. I was able to provide testimony in opposition to House Bill 6 on behalf of the Ohio chapter of the AAP, so really a strong voice on behalf of all of Ohio's pediatricians. In the context of our governor prioritizing child health, I did feel like it cut through some of the noise around this bill. I've got a lot of engagement from his administration and from policymakers on this one. What unfortunately happened is that this time around, bundling the repeal of renewable energy and energy efficiency with the bailout of the nuclear plants turned out to be a successful strategy, and with a lot of spending from one of our utility companies. This bill unfortunately passed. The battle's definitely not over. There's some momentum around a public referendum on this bill. But I will say the positive thing about this experience and every iteration of these attempts to repeal our efficiency and renewable energy standards is that our clinician voices are getting stronger. There are more of us at the table. We're able to speak more on behalf of our professional society state chapters. And from the response that our legislators and the governor's administration offered to our outreach, I think that the health messaging was probably the one message that maybe most effectively sort of cut through the noise. And so I'm optimistic that our network is still going to be able to make an impact in the next iteration of this battle in sort of educating the public and keeping our policymakers informed. It was the other thing I guess I'll say about it is it was sort of a interesting list of stakeholders who were in opposition to this bill, sort of people that are not kind of strange bedfellows, I guess I'll say. Opponents of the bill included consumer groups, the Ohio Manufacturing Association, the American Petroleum Institute, wind energy groups. So it was just sort of an eclectic mix, and health groups. I think one of the learnings that I'd like to improve upon sort of with our next iteration is that despite the fact that clinician voices were much louder this time around, when the popular media reported about opposition and support for House Bill 6, I felt like there wasn't enough emphasis on the fact that health groups were also pretty unanimously and vocally opposed to this bill. The list of opponents often included consumer groups and environmental groups, and I felt there was sort of an underappreciation in the popular media about health groups' voices. And so that's something that we want to sort of amplify even further with this next round. Next slide, please. So this is a photograph of some of our Ohio Clinicians for Climate Action members in front of the State House last year. We've recently brought a new coordinator on board and are really kind of rebooting and growing our network. So we feel like the next couple of years are going to be really critical for state-level advocacy in Ohio. The last thing I'll say about that is that we can't meet the Paris climate goals without Ohio. And so we know that our state is really important in the national conversation around energy efficiency. So we're in it for the long haul. I think that's my last slide. I think the next slide is just a thank you. Yep. So we have a few minutes for questions. I appreciate the opportunity to participate.
Thank you so much. And that was a great presentation. And I will just run through these two slides very quickly and give everyone an opportunity to type in your questions into the chat box. We've had a lot of questions coming through, and I will just let everyone know that we will spend the next 6 or 7 minutes or so answering your questions, as many as we can, to be able to end on the hour at 2 o'clock. But for those of you who we haven't gotten to your questions yet, by the end of the hour, we will try and send you email responses. So hopefully that will suffice. And just wanted to put this up here, upcoming webinars. We will have the next one coming up in our series later in the month in August, and I wanted to highlight an upcoming E for the Future webinar that will be held in September. That's going to be highlighting examples from their newly released Energy Plus Health Playbook. So the registration link is here, but we'll also have this on the webinar recording that you can click to as well. And then this is a plug for our upcoming conference on health, environment, and energy that's going to be held in January of next year in New Orleans again. We had our first conference in December of last year, so we're looking to really build on that conference and to really try and integrate these different sectors more and expand on this good work. So hopefully you will attend. So now moving to Q&A. Let's see. I'm going to try and combine a couple of questions here, and this will be for both Dr. Severity and Dr. Bull. So do you have any tips for non-medical organizations for talking with health practitioners about these issues to gain their support? And then as a second question, kind of added on to that, do you have any tips on how to share these health data with policymakers? So whichever, Mona or partner, you want to take that first.
I can start, and then Mona, you can jump in. I think in communicating with medical professionals, referring to the published policy of our medical professional societies is incredibly powerful. And actually, the Medical Society Consortium webpage that Mona showed a screenshot of has a lot of those accessible in one place. So it's a great place to go for both peer-reviewed literature and references, but also the official policy statements of our medical professional societies as sort of a nice way to lead into a discussion with a clinician. So I think that's probably the first thing I would say. What else would you add to that, Mona?
I think that covered it pretty well. We really do have a wealth of materials, PowerPoint presentations, policies that can help inform anybody who would like to work with their colleagues and to try to let them know, how important this is, the health impacts, the interplay between energy efficiency and health. And so I encourage everybody to do that. You could also sign up for the newsletter. And if you are taking action, you can let us know what kind of action you've done. We've got a portal over on the right side of the website, and you're invited to let us know if you give a presentation, if you publish an op-ed or a letter to the editor, etc. And we are trying to get our arms around the activism that's going on nationwide. We know it's growing, and we have a record that it's growing. I think we have a record of only a small portion of what's actually happening out there. And it's encouraging to everybody to understand that the activism is growing and that it's not hard to be involved. A little bit of information and materials, a little support, and you can be launched in terms of being involved.
Great, thank you. And this one is for you, Mona. Does the 2017 report that you mentioned from Medical Society cover any topics or issues relating to environmental justice, low-income communities, or communities of color?
Yeah, well, the report is very clear about the fact that communities of color and low-income communities are more vulnerable to the impacts of climate change. And so, without paying attention to the needs of those communities, we can't really sufficiently take on the challenges of either mitigating the actual the gases that are going into the air, or adapting, making the adjustments and taking resilience measures that we need to really sufficiently defend the people of the country against what we know is happening out there. So we see that as very important. And we have a recent policy agenda that was released on June 24th, called the Call to Action on Climate, Health, and Equity, a policy action agenda. And you can find that on the website as well. And that makes it even clearer that it's vitally important to pay attention to equity issues and to focus on the needs of vulnerable people and communities.
Great, thank you. And this might be a question for both of you. To the extent that you can, Aparna, speak to your experience in Ohio, and Mona, if you have anything to share about the Clinicians for Climate Action groups that have come together in states. Can you describe how you built your coalitions to work across sectors to advance energy efficiency policy? And I guess this could also be clean energy policy more broadly for the clinicians groups across other states. But I don't know if Mona or Partner, you want to kick things off first?
Sure. Yeah, as Mona said, there's a growing list of these coalitions in various states, and one thing that's been really gratifying is that those of us who are doing this work are sharing with our peers in other states and helping these networks to sort of multiply. Like we've recently connected with people in Wisconsin and Georgia and other states where clinicians are looking to do this work, and having the National Medical Society as sort of a template for with the kind of coalition we'd like to build within our state is really helpful. So we, in Ohio, we had sort of a very passionate group of environmental advocates among clinicians in Northern Ohio. I personally have been engaged in this work for a while, and I have some colleagues that are as well. And so we decided to work with the Ohio Environmental Council to help us with our organizing and to connect those clinicians with advocacy opportunities. And that's been a nice way to link us to other voices in this advocacy space, because the OEC's advocacy network includes engagement with other sectors. The Ohio Hospital Association has also been really a nice way to connect with other sectors and to bring in collaborators from other hospitals. I work with an organization called Healthcare Without Harm that has many member hospitals across the country that are engaged in healthcare sector sustainability. And so their network has been a very helpful way for us to identify clinicians who are at those member hospitals to participate in our coalition. And we've also done some outreach through state chapters of medical professional societies like the Ohio chapter of the AAP, and that's kind of ongoing. Like we're going to have a presence in this year's annual meetings for the Ohio AAP, for the American Thoracic Society. There's the chapters that are located in Ohio, and looking at putting some publications like articles and invitations to join us in some of the publications distributed by those organizations. For Ohio AAP, it's Ohio Pediatrics, and we'll have an article in the fall with an invitation for people to contact us if they're interested. And finally, we've done sort of an exchange of speakers for grand rounds presentations at our academic hospitals, and looking at also continuing medical education events on a larger scale, which I know has been done in Virginia and other places. So a lot of different tactics.
Fantastic, thank you. Mona, anything to add to that?
Yeah, I guess I would add to that, you know, although it's often easier right at the outset for people to come together if they're in the same field, because there are so many organizations that bring together people within certain fields. But once you've got that kind of nidus of organization, it becomes clear that collaborating with organizations in other fields is essential if there's any hope of creating policy change. And so often, you know, a good place to start is kind of bringing your colleagues together and agreeing that this is something which is of vital importance. It's a crisis. There's a, you know, strong imperative to do something about it. But then as you begin to form, then, you know, to reach out to other organizations that may know better what's happening in your state, and may also, you know, really share the concerns. And I think at this point, there are many people out there that share the concerns. In fact, the work done at the Center for Climate Change Communication shows that the percentage of Americans who now feel that climate change is personally important to me is up to 73%. And that's a significant rise. And the greatest rise is amongst those who are at the more conservative end of the political spectrum. So, you know, figuring out how to get organization to organization and to begin your thinking about how to proceed, and then to join and collaborate with other organizations, I'd say would be the vital steps. And some might do this through community civic groups like the Rotary Foundation or the Lions Group, or, you know, whatever civic foundations there are in your area. I understand that International Rotary, for instance, has published quite a bit on climate change, and there's a great deal of concern. And so, you know, there are civic organizations in every community, and you have to work with whatever you've got and then go from there.
Excellent, thank you. And thank you to both of our speakers today. We'll have to wrap things up here, but I really want to thank you both for your time. I know you both are very busy, as you can see by their lengthy titles here, and we really appreciate you sharing your knowledge and experience with everyone. And to everyone on the line, just to reiterate, we will be sharing this recording with you all. You can expect a follow-up email within the next week with a link to that recording. And if you'd like a copy of the slides, my email will be in that follow-up email, so just feel free to reach out to me directly for that. And to those of you whose questions that we didn't get to, we'll try and follow up individually with some responses from our speakers. So thank you all again. We really appreciate it, and we hope to see you on the next ACEEE webinar series webinar. Thanks very much.
Thank you.
Thank you.